Okay, good morning. Can you hear me?
Yes, Doc, we can hear you.
Okay. So first of all, I'd like to introduce myself. I am Dr. ROJoson. I'm a graduate of the Master in Hospital Ad in the UP College of Public Health in 1991. I'll be talking about the system thinking in healthcare facilities for this particular class, H8202. Okay, so the prescribed learning outcomes will be the following. At the end of the session, the student is able to understand how to run and manage a hospital effectively and efficiently by systematically using the system approach or perspective and system thinking. Understand the importance of alignment and integration in managing a hospital and its department. Describe a hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. And then lastly, to discuss the common challenges encountered in the governance of departments together with their suggested strategic solutions. With these prescriptions given to me by the course director, I shall delimit my presentation on health facilities to hospital, because when you say health facilities, it's a very broad area. Okay, so I'll just limit myself to hospitals, but with focus, again, with focus to departments, since we are on HA202, rather than on the whole hospital. Thus, I will change my title then to System Thinking in Hospital with focus on departments so that I'll be aligned with the learning objectives and outcomes. So let's start with the structure and basic functioning of the hospitals. All hospitals are made up of many different departments and services. We look at the hospital as a system, that is, a set of interrelated and separate parts working towards a common purpose. As hospital managers, we must know how to manage the hospital effectively and efficiently by making sure that all the various different departments and services, there's so many of them, are aligned and integrated in their governance and functioning. System perspective, system approach, system thinking, these are various terms that one will encounter in the management discipline manuals and in the internet, and all are geared towards ensuring alignment, coordination, collaboration, and integration of the functioning of the interrelated parts of a system, which are the different departments in the and offices in the hospital. Suffice it to say that systems perspective or approach to the management, it views the organization of the hospital and also of the department of a hospital as a unified, purposeful systems composed of interrelated parts. This perspective or approach makes the manager sees the organization as a whole and as part of the larger external environment. So the whole and as well as part of the larger environment, and also the different interrelated units or departments. System thinking, on the other hand, is a holistic approach to analysis that focuses on the way that the system's constituent parts interrelate and how the systems work over time and within the context of a larger system. Put it in another way, system thinking is basically a way of helping a manager to view the systems from a broad perspective that includes seeing overall structures, the whole hospital, and also in relation to the environment, okay, patterns and cycles in the systems, rather than seeing only specific events in the system. This broad view can help the manager to quickly identify the real causes of the issues, the root causes of the issues in the organizations, and know just where to work to address them. System perspectives, approach, and thinking are management disciplines that are concerned with an understanding of a system by examining the linkages and interactions between and among the components that comprise the entirety of that defined systems. The bottom line of system perspective, approach, and thinking is the recommendation for all managers to view and analyze the situations in the hospital and in the departments holistically and comprehensively, and to always look at the interaction of parts to other parts, to the whole, and vice versa, with adjustment and integration as key result areas and key performance indicators. Again, I repeat, alignment and integration as the key result areas and key performance indicators. What is alignment? So there are two keywords here, very important words here, alignment, integration. Let's start, let me define first alignment. Alignment means the state of consistency among the plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis that support key organization-wide goals. So practically everything in the system. So this definition is gotten from the Baldrige Healthcare Criteria for Performance Excellence. Alignment means consistency between the hospital plans and the hospital goals. So plans and goals, consistency between the department plans and department goals, and most important of all, consistency between the department plans and the hospital goals. It also means quality of doing things toward the same direction. So alignment, consistency. Thus, to be aligned, all staff should be clear about the hospital's purpose and policies and procedures, as well as those of the department, and make decisions in accordance with them. So not only knowing the hospital's policies and purpose, but also the department. Integration, on the other hand, is another important word, that objective outcomes that we have to achieve, one of the key performance indicators, and ultimately the most important also. It just means the harmonization of plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis to support key organization-wide goals. So the key word here is harmonization, whereas in alignment, it's consistency. Again, this definition is gotten from Baldrige's Healthcare Criteria for Performance Excellence. So integration means harmonization between and among parts in the hospital and also in the departments to produce a unified outcome or goal. It is said that effective integration goes beyond alignment and is achieved when the individual component of a system operate as a fully interconnected unit, such as harmonization of music by an orchestra. In effecting harmonization and integration, it is implied that coordination or synchronization, collaboration, or cooperation of the different parts are very, very important. This slide illustrates the concepts of alignment in number 3, okay, and integration in number 4. Number 1 illustrates the complete absence of uniform or consistent direction of the arrows representing the processes in all different directions. So there's no consistency here. Okay. So this is in the stage of reacting to the problem. Okay. Number two illustrates some amount of uniform, relatively some uniform directions of the arrows and the processes. So this is an improvement of the first phase. So this is the phase of early systematic approach, which should be further developed into alignment and eventually an integrated approach. As I said, the ultimate target is this one, integrated approach. As mentioned earlier, in effecting harmonization and integration, coordination and collaboration of the aligned parts are very, very important. This slide shows alignment on the left side. Then with coordination and collaboration of the different parts, integration is achieved. So these are the key keys to performance excellence of a hospital. Back to system thinking in hospital with focus on the departments now. As mentioned, all departments are made up of so many different departments and services. The number varies from one hospital to another. The minimum will be one imposed by the Department of Health licensing body or the Ministry of Health in other countries. Okay. So in the Philippines, we have the so-called level one, which consists of the basic departments and services. Then level two with medical specialties, but without a training program. So there's some specialization here, but no training program. Okay. So that's level two will have more departments and services than level one. In level three, it could be the same as level two, except that there are training programs already. But usually level three has more different departments and services. Examples of hospital departments and services are the following. I just grouped them in several categories. Medical services departments will include the different departments like emergency room or department of emergency medicine, outpatient department, inpatient department, and then diagnostic departments. So examples of diagnostic departments will be the laboratory medicine department, radiology, ultrasound, and others that can be created by the hospital. Treatment departments. So these are the operating room complex, OBGYN or obstetric gynecology complex, rehabilitation medicine complex, the medical specialty departments like internal medicine, pediatrics, surgery, OBGYN, ENT, ophthalmology, orthopedics, anesthesiologists, and others. And then under the treatment departments will also be the nursing service and also the dietary departments. Under the medical support departments, you have the facility management department, housekeeping department, security services, billing, and cashier department. Examples of administrative support departments would be the quality and patient safety department, materials management department, human resource development department, business development department, finance accounting department. As I said, there could be more. Okay. So others can be created on the basis of the needs of the hospital as deemed necessary by the owners, by the hospital administration. Thus, roughly, a hospital can have a minimum of 25 departments and services, and the number could be more, up to 50 or even more. This slide illustrates the importance of alignment, coordination, collaboration, and integration of all the departments and services to effectively and efficiently achieve performance excellence of a hospital. Let's now focus our discussions on the departments. Just as the hospital is made up of different interrelated parts in terms of departments and services, As I said, there could be 25 or even more, up to 50. Okay. So the hospital's made up of different parts or departments and services. This is to facilitate achievement of its corporate goals. And each department and services is also made up of different interrelated parts to facilitate achievement of its authorized functions and services. Each department and service is also considered as a system, as in a hospital. The hospital can be called the super system, probably the bigger system, super system, and the department and services within the hospital could be the subsystem or smaller system. Each department and service must utilize the system approach, perspective, and thinking in management as in the whole hospital. That is, understanding the system by examining the linkages and interactions between the components that comprise the entirety of the defined system, which is the department. But it must be consistent and aligned and integrated with also with the entire hospital. Viewing and analyzing the situations in the department holistically and comprehensively, and to always look at the interactions of parts to other parts and to the whole and vice versa, with alignment and integration as key results areas and key performance indicators. And not to say there must be alignment, coordination, collaboration, and integration of each department and service within the hospital, the whole hospital, and with the other departments and services. These slides illustrate hospital and departments as systems with interrelated parts, with the hospital being the super system, with the various departments as subsystem, okay, and the interfacing departments as co-systems. Okay. Hospital, department, okay. Each department is also a system by itself with interrelated parts and processes. When planning and when doing problem solving, all managers should have a perspective and analytic thinking that look at the parts simultaneously at the whole and also vice versa. Parts and whole and part. Okay. The approach should be holistic and comprehensive and systematic, using the input, throughput, and output processes that consider the external as well as the internal environment. The key result areas of the system approach and thinking should be, again, I repeat, alignment and integration of all the subsystems or parts towards achievement of the department, vision, mission, goals, and objectives, and eventually the, the whole hospital's vision, mission, goal, and objectives. This slides shows the essential and basic components of a department which must be present to facilitate accomplishment of its authorized functions and service and achievement of its goals. So, leadership is one component, then authorized functions, authorized services, then the goals, architectural design, engineering and construction, physical structure, Ministry of Health of Department of Health licensing and structural requirements which must be complied with, policies and procedures, risk management program, human resource program, equipment and material program, data, document and records program, business development program, budget program, IT-enabled system. And then another box is the regular performance evaluation and continual improvement program. If I count it, there are about 20 boxes here, okay, 20 components. All of these components must be present, aligned, and integrated with each other in order to achieve performance excellence and for the department at least, then eventually for the entire hospital. At this point, I'd like to disclose that the Department Design and Development Framework Administrative Design and Development Program was developed by yours truly in 2020 to facilitate learning, planning, and administration. The Department Design and Development Framework is applicable to all kinds of departments and services in the hospital, such as the emergency room, surgery department, operating room, and housekeeping department, and other departments. To fully develop this framework, there must be a manual, okay, a primer or manual that contains the description, elements, and management system of each box. So if there are 20 boxes, there must be 20 description of the 20 management system. So this will be, the manual will be called the Design and Development Blueprint. After the design and development blueprint, there must be evidence of implementation and evaluation of the results of the implementation. So here will come in the regular performance evaluation that will make sure that this is being done. I shall now discuss the hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. On the extreme left of the framework, there are 4 boxes that refer to the hospital and interfacing departments. Whatever be the department, the administrative design and development program should be aligned and integrated with the whole hospital's concept and design, governance policies and procedures, operation policies and procedures, as well as the interfacing units, operations, policies, and procedures. In other words, there must be a system perspective and system thinking. So let's start with this box here, leadership. So whatever be the department, there must be a competent head with at least the following competencies, the general minimum competencies. Unit technical requirements or competencies on the specialty. Each department is usually made up of a particular specialty. So the head must have a competency on that particular specialty. Hospital teamship means know how to play as a team, okay? Then managership and leadership. Those are the 4 minimum requirements. There must be at least a job description, job specification, and performance evaluation system of the leaders and managers, including the CEO, the chief of hospitals. Functions, there must be a document stating the authorized functions of the unit. It must be complete and clear with general and specific functions, and it must be authorized by a higher office. It's not enough that the head of the department just formulated the functions of his department, okay, and it must be authorized by the higher office and communicated to other departments. Service. There must be a document stating the authorized services of the unit. The services offered by a department and the functions authorized must be congruent with each other. Goals. Goals, there must again be a document stating the ultimate goals which must be aligned and integrated with the goals of the entire hospital, the super system. The basic essential goals, okay, will be the following. When I say basic essential, it's practically seen in all the departments, in all the hospital. Okay. So number 1, of course, you want performance excellence, client engagement, quality and safe healthcare services, cost-efficient or value-based services, and then maximal utilization of services. All these goals should eventually be contributing to the financial viability and sustainability of the department as well as of the hospital. This slide shows the basic processes of management in the department design and development framework, the input, leadership, functions, and services, and the output will be the goals, and the throughput will be all these boxes in between the input and the output. Let's now go to the DOH licensing structural requirements, or for those international students, you can call you can label it as Ministry of Health. Okay, so this means compliance to the Ministry of Health guidelines in the planning, design of a hospital and other health facilities. There usually a guideline, a primer on this issued by the Department of Health or Ministry of Health. Then there are also guidelines on safe hospital initiative, which is usually composed of three indicators: structural, non-structural, and functional indicators. And then the building code, fire code, local government requirements. The physical structure. This refers to the geographical space or area in the hospital to construct the department to receive patient and physician clients requesting for services and to house the staff who will perform the functions of the department. The service requirements as dictated by the authorized functions is the first determinant of the physical structure of a department. The other determinants of the physical structure are the following. Number one, statutory and regulatory requirements. Ministry of Health or DOH, Department of Health licensing requirements. And then building code, fire code, local governments requirements. Then if there are a lot of there are specialties in the hospital, so specialty requirements, particularly on the training and research, human resource program, equipment and material program, data and document records program, budget program, risk management program, business development program, and there are more. Okay. So other determinants will be the quality standards and then community expectations. So this will influence the structure that will be set up by the department, efficiency in the workload, in the functioning of the department, caseload, and of course, very important is the owner's one, especially if it's a private hospital. Architectural design and engineering construction. This will be dictated by the Ministry of Health or Department of Health licensing and structural requirements and the physical structure requirements. The minimum, it will be, there's a minimum requirements by these government institutions. Okay. Human resource program, there must be a document showing job descriptions, job specifications, and performance evaluation of the human resource in the department. There must be documentation of adequacy in number of the staff, workforce, and also in the competency. Equipment and material program, there must be documents showing the adequacy of equipment and materials needed to facilitate an effective and efficient functioning of the unit or the department in consideration of the key functions and services of the unit. Also, in consideration of the statutory and regulatory requirements and other objectives like business development, risk management, and IT-enabled system. Data documents records program. There must be a document. Okay. So that will show the adequacy of the data, documents, and records needed to facilitate an effective and efficient functioning of the unit in consideration, again, of the key functions and services of the unit, statutory requirements, and regulatory requirements and other objectives like business development, risk management, and IT-enabled system. Business development program is another box here, another component which must be present in a department. There must be documents showing the presence of a structured and comprehensive program that will develop the business of the unit, of the department, to make it viable and sustainable. Budget program, a document showing a budget that projects the future income and expenses of the unit, and the budget is being used as a guide for day-to-day performance and financial evaluation at planned intervals, every 6 months, every 3 months, every year. Risk management program. There must be documents showing a risk management program, which is a plan and systematic process or program primarily to reduce or eliminate the probability of a risk that usually result in injuries, losses, and legal suits. But it may also include risks with potential positive effect like improving business and client engagement. IT-enabled system, there must be documents showing the use of information technology or IT to promote efficiency in the performance of functions and accomplishment of the services, to manage information to the unit like getting the information, storing them, protecting, processing, transmitting as necessary, and later retrieving as necessary, as needed also. And to create interconnection with other units in the hospital for timely communication, coordination, collaboration in accomplishment of the services of the unit as well as of the whole hospital, to communicate with the patient and physician clients both in and out of the hospital. Another box here will be the policies and procedures, clinical practice guidelines, and clinical pathways. Again, there must be documented policies, procedures, clinical practice guidelines, clinical pathways that serve to provide order, to promote standardization, and to facilitate communication, and promote effectiveness and efficiency, and lastly, to provide a guide to present and future staff, among other things. So it must be documented so that the future staff will know, will be able to read what are the guidelines and what transpired before and what is existing now. And the policies, procedures, clinical practice guidelines, and clinical pathways must be aligned with the policies and procedures of the hospital. This should be reviewed and revised periodically. Just a word, just a definition on the clinical practice guidelines. So clinical practice guidelines and clinical pathways are akin to policies and procedures, but they focus on patient management. This is the usual concept here. And clinical practice guidelines is defined as systematically developed statements built on synthesis of evidence, which provide formal recommendations, note recommendations, okay, about appropriate and necessary care intended to assist the practitioners, the physicians, and the patients to make decisions about appropriate and health care for specific clinical circumstances. I'd like to emphasize that clinical practice guidelines provides recommendations, or that's why it's called guidelines. Okay. And then pathways will be an interdisciplinary plan of care that outlines the optimal sequencing and timing of intervention and expected outcomes for patients with a particular diagnosis, procedures, or symptoms. So this one is, you spell out the players here. There are different departments involved here, different staff, and then what are expected of them to do in coordination and collaboration with each other. I think this is the last box here. Regular performance evaluation and continual improvement program. There must be a document again that shows a program to appraise the extent of accomplishment of the unit, the department, in its authorized functions, number one. Number two, the business plans. As at planned intervals could be quarterly, biannually, or annual. And then, of course, after appraising, there must be a plan to improve, okay, and act on them. Let's now go to the last learning objective, which is the common challenges encountered in governance of departments together with their suggested strategic solutions. The challenges can be in at least five categories. This is at least, but this is the more common ones: man, system and method, machine and equipment, money and other resources, trends in hospital industry, healthcare, and medical science. Under the man categories are the consultants, residents, if you have residents there, okay, colleagues in other departments, chief of hospitals are also part of the within the man categories, and of course the subordinates. The more common problems are the competencies of these people, okay, quantity, alignment, coordination, collaboration, integration, which is very not very easy, very difficult. And then personality, of course, is another issue. So suggested strategies consist of leadership and manager skills, okay, of the head of the department. Okay. Managing your boss, meaning you can manage the personality of your higher ups, okay, and adjust according to his or her mindset and mood. Okay, that would be part of the strategy. Okay. And then use of multi-sectoral, multi-professional committee meeting to engage everybody into, as I said, this is alignment, coordination, collaboration, integration is the biggest challenge in practically all hospitals. So you can use the multi-sectoral, multi-professional committee meeting and interaction to promote this. Under the system and method category, common problems are lack of systematization in doing things, lack of standardized procedure. So there must be manuals. Okay. So you can use the DOH licensing requirements as a guide, use the quality standards also as a guide, such as we have the PhilHealth Bench Book for the Philippines. You have quality standards for the Joint Commission International, such as Joint Commission International, Accreditation Canada, and others. And most important of all, whatever you do here above, if you use the quality standards, you must establish quality policies and procedures, clinical practice guidelines, and clinical pathways to guide the, uh, the system and also to guide the personnel. Under machine and equipment categories, common problems are lack of management system of all the equipments and machine, lack of calibration and preventive maintenance of machines and equipment. And then the suggested strategies, of course, will be to come out with policies and procedures and then implement them and evaluate them at intervals. Under money and other resource category, we all know that limited resources is always a problem. So there's no end to that, okay, problem. Suggested strategies will be dependent on the leaders now and also on how he can get the money and how innovative he will be. So it's very important to have a leader who can accomplish getting support funding for the hospital. Under the trends in hospital industry, healthcare, and medical science category, the most common problem is the rapid changes in trends, which oftentimes are difficult to cope, especially nowadays. For the last probably 5 years or even 10 years, there's a rapid changes in everything. Okay. Suggested strategies to come out with a knowledge management system in which you constantly track and continually educate your staff. Okay. And then you do benchmarking with other hospitals. And of course, since you cannot follow everything as to the trend, you try to innovate okay, to be more practical and to be cost efficient. Okay. I like to end my lecture by flashing again the topics that I have covered. Okay. So these are again, the learning outcomes. Understand how to run and manage a hospital effectively and efficiently by systematically using the system approach or perspective or systems thinking. Understand the importance of alignment and integration in managing a hospital and its departments. Describe a hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it, and discuss the common challenges encountered in the governance of departments together with their suggested strategic solutions. And how to run and manage a hospital effectively and efficiently by systematically using the systems approach, perspective, and systems thinking. Okay. I like to suggest that you try to remember these slides that illustrates the hospital and departments as a systems with interrelated parts, with the hospital being the super system, with the various departments as the subsystem, and the interfacing departments as cost system. So each department is a system by itself with interrelated parts or processes. When planning and when doing problem solving, all the managers, all the different heads of the managers should have a perspective and analytic thinking that look at the parts simultaneously at the whole and vice versa. So look at the part in consideration of the whole, or you look at the whole, then go back to the parts, okay? Vice versa. The approach should be holistic and comprehensive and systematic using the input, throughput, output processes that consider the external as well as the internal environment. And the key results areas should be alignment and integration of all the subsystems towards achievement not only of the department but also of the entire hospital. So this one emphasized the importance of alignment and integration in a hospital. So to remember this particular objective, just remember, try to remember the slide showing the pictorial differences between alignment and integration and steps toward a mature process. So as I said, let me repeat, the ultimate target is integration, which is, to tell you honestly, it's not really easy. Okay. And remember also this slide that illustrates the importance of alignment, coordination, collaboration, and integration of all the parts towards achievement of performance excellence for not only for the department, but also for the hospital. Now, for the hospital design, okay, I hope just remember this diagram, okay? It is generic. It is applicable to all departments. It is comprehensive. It facilitates learning, planning, and governance of a department. What is left to do is just to put in the details, contents in each box, and compile them in an operations manual. Okay. Okay. So all the contents here will be dependent on your particular department and also in your setting. Common challenges encountered in the governance of departments. Just remember this starting table with the 5 categories: man, system, methods, machine, equipment, money, and other resources, and trends in medical sciences, etc. And then try to recall the more common problem and under each category. Okay. You can try to remember my suggested strategies, but I leave it up to you. You can add more as needed based on your settings and circumstances, particularly on these strategies, because you have different settings. So with that, I really hope you have acquired the prescribed learning outcomes through my presentation. Thank you for your kind attention.
Oh, Okay,
Okay.
thank you very much. And this is the time that we will ask for questions from the class. But before I proceed with that, I would just like to remind the class that I shared a meeting note that has the link to the Olete and also the learning log for this session. Okay. So does anybody in the class have any questions about systems thinking when applied to healthcare facilities? You may use the reaction uh, to raise your hand, or you may type in the chat. Any questions from the class?
By the
This is
way,
with the assumption. Yes, sir.
if
Yes, Doc.
the participants might be wondering what's OLETE means.
Oh,
OLETE,
okay.
OLETE means Online Learning Cum Evaluation Test Exercise, which I created to reinforce your learning through after this lecture. So you just try to answer it online, okay? And then if you don't get a perfect score, you just repeat it until you get a perfect score. So this is more for mastery of learning.
Doc, I also linked it to the canvas, but I can set a deadline for it. When do you want the link to close so
I
that you
leave
can
it up to you.
finalize?
If it up to you, I think it's best to do it as soon as possible. But
Yes.
so,
Okay. So maybe I'll set the deadline to tomorrow, class, so that you can take all of your attempts before tomorrow, so that Dr. Hoson can check your performance. Okay. Any questions from the class? Should I be calling it like an auction now? Going once, going twice. This is with the assumption that you all understood. Okay, systems thinking. And systems thinking is a skill. So, as Dr. Hoson said, it's not something that you can learn in just one sitting. It's something that you need to practice over and over. And in various, well, in my opinion, in various aspects of your life. No? Even in hearing the news stories, in when you listen to your favorite news channel, okay, you can apply how systems thinking, no, and how things are working, and you can actually see where things are going wrong. No, when you get used to applying systems thinking, for example, you can see how, oh, they're not putting a policy down on this one, no, on this aspect of the system, and that is where things are not working well. Okay. So this is something that you need to practice every day. You need to practice it in your organization as well. No. Okay. So I am assuming that since there is no question from the class, there is no chat, that nobody has any questions. Okay. So I would like to thank Dr. Hoson, no, for coming even after his busy schedule. And how are your eyes, sir?
yeah,
How are they
you're
doing?
okay.
I was
I have a permanent damage already in my optic.
Oh, oh
One
no.
part, but
I
I
see.
can still see. I can still see.
Okay, at least, okay.
Yeah, yeah,
That's good news.
yeah.
Dr. Hoson just came last week from a surgical mission that apparently
Who,
three of my acquaintances and friends were there with you. So,
who, who?
uh, Dr. Jean Arevalo, the
Okay,
dentist,
okay.
also Dr. Raymond De Vera, and Dr. Talens also, I know
Ah,
him.
okay,
So
okay.
they were all
Okay.
there with you apparently. Like
Yeah,
all of you, except Dr. Talens, but the Dr. Raymond and Dr. Jean told me that they were in missions for last week,
yeah.
but I didn't put it together that you were all together.
Ah, okay, okay,
Yes.
okay. So no more
Right.
questions. Last call.
Last call. Anyway, oh, there is
Oh,
a question. Okay. So from Dr. Tio. Good morning, sir. I would like to ask, in what ways does systems thinking support crisis management in hospital?
okay. So it's still applicable in crisis management because when you do the crisis management, you have to analyze the everything, the root cause, and then how to solve the problem as the soonest time possible, or take your time, etc. So you have to consider all the uh, all the possible causes. No, you can consider the root causes and also the other adjunctive causes, and then you also have to look at who are the players involved. No, you don't only look at the person involved in that particular crisis, but you look at the circumstances behind that person's uh, doing. Probably when he created the crisis, then you also look at the possible causes, and then when you manage it, you don't only blame you don't put outright blame on the a person who created the crisis or a system who created the crisis. You also look at the surrounding factors. No, it might be due to other systems at fault, no, in your hospitals, and then you try to solve it. Okay, so that's part of a system thinking also. Okay,
If
is
I
that
may
okay?
add, in
Okay,
fact, with the prerequisite of systems thinking that you need to know the underlying structures of the system within your organization, it's actually most useful in many ways in crisis management because you need quick thinking, you need to make quick, spontaneous decisions, and with the pre-existing knowledge of how your system works and the leverage points, you can make all of those decisions in a heartbeat. No? So that's actually where it shines. Systems
okay.
thinking.
Did I
Okay.
answer your question, Ling? Liting yon? Okay,
And
okay,
she gave the thumbs up earlier.
okay.
Okay. So any other questions? Okay, so even if you're thinking of your questions now, we will have next week we will have Dr. Hoson again. Wait, let me check our
What do you want?
schedule.
The quality systems or the department?
That's up to you, Doc. But if it's a logical progression, I think it would be quality might be more logical for next week,
Okay,
and then you
okay,
go into the department.
okay.
Yeah, so systems thinking, and then next week is importance of hospital quality accreditations, and then managing the Department of Surgery. So you have 3 sessions in a row.
Yeah,
Yeah,
okay.
so next week we will have that. So you can actually still ask your questions if you want, or you can forward your questions in the group chat. No, and I will forward it to Dr. Hoson. No, um, so, thank you very much, Dr. Hoson,
You're
for giving
welcome.
us your time and expertise. And thank you, everyone, for coming to the class and listening attentively. Okay, so hopefully next week you will have more questions for Dr. Hoson. Okay,
Let's
and that,
picture.
oh, let's have a picture. Okay. Everybody, can you turn on your cameras, please? Okay, let me just, and give us a smile. Okay, 1, 2, 3. There we go. Thank you, everyone.
Okay, thank you.
See you next week.
Bye bye.
Thank you,
Thank
Prof.
you.
Thank you po.
Bye bye. Thank you.